Ichthyosis is very unsightly and difficult to accept for many people who are not familiar with it. Therefore, they will distance themselves from patients with ichthyosis and even mock and attack them. Patients with ichthyosis who grow up in such an environment will experience a large number of psychological problems. Firstly, in childhood, they didn't like going to school, especially in summer due to exposing their skin on awful limbs. They may often be laughed at. In youth they yearn for love and friendship, but is afraid to express it, thus suppressing their emotions. As we age, joining the military, working, and getting married have all become pressing issues, so some patients with ichthyosis simply give up on themselves and stay at home, away from socializing. So as a ichthyosis patient, how should we solve such a problem? I have been working at gene therapy for over 20 years and have seen various types of patients. To sum up, it is important to prioritize treatment, seek early treatment, and seek treatment from a young age to minimize physical and psychological harm. The symptoms exhibited by different types of ichthyosis are different. Patients with mild symptoms usually have scales on their legs, followed by scales on their limbs. This situation is not too serious and can be cured with treatment within a week. A more severe condition is the presence of scales behind the ears, on the backs of hands and feet. Common colors are gray and white, and more severe cases can also be brown and black. These relatively severe symptoms are often accompanied by keratosis pilaris and hands looking like elderly people, and particularly messy palm lines. If it is severe lamellar ichthyosis and bullous ichthyosis, there may also be eyelid ectropion, obvious dark and thick keratin, hyperplasia at various joints, and repeated growth. Some severe patients have a skin odor and a large amount of scales that fall off every day. Although ichthyosis is a genetic issue that is not contagious, this situation is more serious and carries the risk of bacterial transmission to others. Special attention should be paid, and it is best to seek treatment as soon as possible. Whether ichthyosis can be cured or not is a question for every ichthyosis patient. In fact, in the internet era, everyone can find relevant knowledge on the internet. Fish scale disease is caused by genes, and under current legal and technological limitations, the treatment of fish scale disease cannot be solved by changing human genes. During the clinical treatment of ichthyosis, gene therapy has treated over 40,000 ichthyosis patients worldwide and achieved clinical cure. So what is clinical cure? After the treatment, the skin basically returns to normal. We all know that regardless of the condition, even if cured in the hospital, we should follow the doctor's advice to continue resting and taking medication after returning home. For example, diabetes, hypertension, and other diseases, after clinical treatment in the hospital, should also take medicine on time and pay attention to diet at home. So what should we do at home after clinical cure of ichthyosis? It's actually very simple. It is just daily care for the skin, bathing and applying skincare products according to the requirements of a dermatologist is sufficient. Is it possible to treat ichthyosis solely with moisturizing cream? The answer is definitely not possible, because moisturizers can only maintain humidity on the skin scales and cannot remove or reduce them. We all know that the skin of patients with ichthyosis is different from that of ordinary people, and the fundamental reason is that the metabolic cycle of the skin is different. The metabolic cycle of normal human skin is 28 days, and the epidermis naturally sheds and is not easily noticeable. The metabolism of fish scale skin only takes 3-5 days, and premature aging cells cannot become healthy epidermis and naturally shed instead. They form glial substances mixed with keratin and garbage, which not only cover the surface of the skin, but also block the 3 major glands: sweat glands, sebaceous glands, and hair follicle glands. Therefore, if fish scale disease cannot be fundamentally treated by unblocking the 3 major glands and improving the cell metabolic cycle, then fish scale skin cannot rely solely on moisturizing lotion to restore health. The key to removing scales is not to remove surface scales, but to restore the basic function of the skin. So, we need to use scientific methods to treat ichthyosis.
Hello, Dr. Yan. Can you show me a case similar to my skin?
Sure, take a look at these photos. All of them are patients with IchthyosisVulgaris. This person's symptoms are similar to yours. Take a look. After 7 days of treatment, they will return to normal. This is the same.
Do you think my cheat day treatment can achieve the same effect?
Sure, you can rest assured. The type of IchthyosisVulgaris is the mild type in the classification of ichthyosis, and the treatment effect is also the best, which can be similar to that of normal people.
Okay, thank you.